Hello everyone, my name is Kim and I have chosen Attention Deficit Hyperactivity Disorder, ADHD, because it is something as a teacher working with preschoolers that I have encountered from time to time. Here is a history about ADHD. In 1798, a Scottish doctor, Sir Alexander Crichton, noticed some people were easily distracted and unable to focus on their activities the way others could. He reported that these symptoms began early in life. In a series of lectures in 1902, Sir George Frederick Still talked about mental conditions in otherwise healthy children of normal intelligence. These children were more impulsive and had problems with attention and self-control. He noted 15 cases in young boys and 5 in girls. ADHD was not included in the American Psychiatric Association's Diagnostic and Statistical Manual of Mental Disorders, the DSM, until its second edition in 1968. Then it identified the condition as hyperkinetic reaction of childhood. In the third edition, released in 1980, the APA renamed the condition Attention Deficit Disorder, ADD, and created 2 variations, ADD with hyperactivity and ADD without hyperactivity. In 1987, the APA changed the name to Attention Deficit Hyperactivity Disorder, ADHD, which combined inattentiveness, impulsivity, and hyperactivity into a single type. Attention Deficit Hyperactivity Disorder is one of the most common mental disorders affecting children. ADHD also affects many adults. An estimated 8.4% of children and 2.5% of adults have ADHD. ADHD is often first identified in school-age children when it leads to disruption in the classroom or problems with schoolwork. It is more common among boys than girls. ADHD in the school-age child. Teachers and school staff can provide parents and doctors with information to help evaluate behavior and learning problems and can assist with behavioral training. However, school staff cannot diagnose ADHD, make decisions about treatment, or require that a student take medication to attend school. Only parents and guardians can make those decisions with the child's physician. Under the Rehabilitation Act of 1973, students whose ADHD impairs their learning may qualify for special education under the Individuals with Disabilities Education Act or for a Section 504 plan for children who do not require special education. Children with ADHD can benefit from study skills instruction, changes to the classroom setup, alternative teaching techniques, and a modified curriculum. Many adults with ADHD do not realize that they have the disorder. A comprehensive evaluation typically includes a review of past and current symptoms, a medical exam and history, and use of adult rating scales or checklist. Adults with ADHD are treated with medication, psychotherapy, or a combination. Behavior management strategies such as ways to minimize distractions and increase structure and organization and involving immediate family members can also be helpful. For symptoms and diagnosis, many ADHD symptoms such as high activity levels, difficulty remaining still for long periods of time, and limited attention spans are common to young children in general. The difference in children with ADHD is that their hyperactivity and inattention are noticeably greater than expected for their age and cause distress and/or problems functioning at home, at school, or with friends. ADHD is diagnosed as one of 3 types: inattentive type, hyperactive impulsive type, or combined type. I'll talk about those 2 on the next couple slides. A diagnosis is based on the symptoms that have occurred over the past 6 months. There is no lab test to diagnose ADHD. Diagnosis involves gathering information from parents, teachers, and others, filling out checklists, and having a medical evaluation, including vision and hearing screening, to rule out other medical problems. The symptoms are not the result of a person being defiant or hostile or unable to understand a task or instruction. The inattentive type, to have that, you need to have 6 of the following symptoms occur frequently, or 5 of the following symptoms occur frequently if you are over 17 years old. Doesn't pay close attention to detail or makes careless mistakes in school or job task. Has problems staying focused on tasks or activities, such as during lectures, conversations, or long readings. Does not seem to listen when spoken to, seems to be elsewhere. Does not follow through on instructions and doesn't complete schoolwork, chores, or job duties. May start a task but quickly loses focus. Has problems organizing tasks and work, for instance, does not manage time well, has messy, disorganized work, and misses deadlines. Avoids or dislikes tasks that require sustained mental effort, such as preparing reports and completing forms. Often loses things needed for tasks or daily life, such as school papers, books, keys, wallet, cell phone, and eyeglasses. Easily distracted, forgets daily tasks such as doing chores and running errands. Older teens and adults may forget to return phone calls, pay bills, and keep appointments. Hyperactive impulsive type, you need the same as the one before. You need 6 of the following symptoms occur frequently, or again, 5 of them if you're over 17 years old. They fidget with or taps hands or feet or squirms in seat, not able to stay seated in classroom or workplace, runs about or climbs where it is inappropriate, unable to play or do leisure activities quietly, always on the go as if driven by a motor, talks too much, blurts out an answer before a question has been finished, has difficulty waiting his or her turn, such as while waiting in line, interrupts or intrudes on others, for instance, cuts into conversation, games, or activities, or starts using other people's things without permission. Older teens and adults may take over what others are. The causes of ADHD. Scientists have not yet identified the specific cause of ADHD. There is evidence that genetics contribute to ADHD. For example, 3 out of 4 children with ADHD have a relative with the disorder. Other factors that may contribute to the development of ADHD include being born prematurely, brain injury, and the mother smoking, using alcohol, or having extreme stress during pregnancy. Treatment. Behavioral therapy and medication can improve the symptoms of ADHD. Studies have found that a combination of behavioral therapy and medication works best for most people, particularly those with moderate to severe ADHD. Behavioral therapy focuses on managing the symptoms of ADHD. For children, treatment usually consists of teaching parents and teachers how to provide positive feedback for desired behaviors and consequences for negative ones. Although behavioral therapy requires careful coordination, it can help children learn how to control their behavior and make good choices. Adults with ADHD may benefit from psychotherapy and from behavioral strategies that improve structure and organization. There are 2 main types of medication for ADHD, stimulants and non-stimulants. Stimulant medications are highly effective treatments that have been safely used for decades. Today, methylphenidate is the stimulant doctors most prescribe for children with ADHD. It was first made in 1944 and marketed in 1954 as Ritalin. At first, it was used to treat conditions such as chronic fatigue and depression, but it worked best to improve symptoms of ADHD. 2 non-stimulant medications, atomoxetine and guanfacine, have also been shown to be effective in treating ADHD symptoms. These medications are alternatives for those who do not respond well to stimulants or if a non-stimulant is preferred. The national organization Children and Adults with Attention Deficit Hyperactivity Disorder, CHADD, notes that many adults report that medication helps them gain more control and organization in their lives. There are ways that parents can help. They can make clear schedules, maintain routines, make sure instructions are understood, use simple words and demonstrate what they want, focus on your child when talking to him or her, avoid multitasking, supervise. Children with ADHD may require more supervision than their peers. Maintain communication with their child's teacher. Model calm behavior. Focus on effort and reward good behavior. Thank you so much for listening, and I would like to wish you and your family a very merry holiday season and a happy new year. Good luck with all your studies.